This is Biernacki. You need calcium to get into your bones, but there's a huge number one calcium mistake that people are making. It's the calcium and vitamin D mistake. We're gonna go over all the new research, the best foods, the best supplements, the best tricks, and the number one mistake that most people are making regarding the calcium. And we're starting now. Calcium is an important component in the human body and critical for human health. It has well been established that calcium intake is helpful, and a deficiency can cause osteoporosis. And this is one of the biggest problems across the world, health-wise, osteoporosis. On the left-hand side is your skeletal mass in grams. You can see the male is about 1,500 at about age 25, 30. The female is on average about 1,200 grams. But you could see at age 50, 60, 70, it dramatically declines, especially postmenopausal females over males. This is a huge drop in bone mass. It has to be prevented for a healthy life. We're gonna go over the big calcium secrets, the new studies, what's it showing in 2024 and going forward. Calcium deficiencies can be anxiety, depression, brittle hair, brittle nails, stomach pain, increased urination, dry skin, tingling feet, cramps, but calcium is controlled by something called your parathyroid gland. This creates parathyroid hormone. More parathyroid hormone creates more calcium in your blood. Less parathyroid hormone creates less calcium in your blood. Parathyroid hormone also controls vitamin D production in your body, and both together reabsorb more calcium in your intestine, and together both can function in putting that calcium level to its proper normal level. How much calcium do you need per day? An adult over 18 up to age 50 needs about 1,000 milligrams or 1 gram per day. Over 50, so between 50 and 70, you need over 1,000 milligrams per day. And women especially need 1.2 grams or 1,200 milligrams per day. And then when you're in your 70s or later, you need 1,200 milligrams as well. You want at least 1 to 1.2 grams every day. And when you're a postmenopausal woman, that's the highest rate of osteoporosis. Because women go through hormonal changes, it affects their bones and they require higher calcium intake. It's even recommended like 1.5 grams or 1,500 milligrams. 25% of women over 50 develop osteoporosis. Very, very common. In society today, we're eating more processed diets. We're drinking more alcohol. We're not moving as much. We're not standing as much. And you could see as you get to age 30, 40, 50, 60, our bone mass goes over a cliff. It starts to deteriorate. We get weaker. Our bones aren't as strong. This leads to increased arthritis, hip fractures, vertebrae fractures, wrist fractures. And if we don't turn this around, we're going to suffer with it, because once you reach a certain age, you're at risk of all these problems, decreased mobility, and then your health only gets worse. How do you get that 1.5 grams of calcium? The easiest way to get it is dairy products, so milk. 1 cup or about 250 milliliters of cow's milk contains about 300 milligrams of calcium. 2 to 3 cups, right there, you've already got 1,000 milligrams. Yogurt, a typical plain yogurt in a cup is about 300 to 400 milligrams of calcium. Cheese, 1 slice of cheese, about 28 grams, contains about 200 to 250 milligrams of calcium. Essentially, you drink 1 glass of milk, 1 cheese slice, and 1 yogurt, and you're close to being good. This list shows specific values, but bok choy, almonds, okra, mustard greens, goat cheese, broccoli, natto is a good one. We're going to talk about vitamin K later, but natto gives you both calcium and vitamin K2. That's a great option. For vegans, you got collard greens, some sesame seeds, some kidney beans, but for people who can eat meat, sardines, cheese, you have yogurt, you have dairy. Kale's another good vegan option. Whey protein, surprisingly number 1, but 3 scoops is a lot. That's a lot for anybody. You'll probably get some gas after that. And milk is really good too. If you're a vegan or a vegetarian, kale gives you about 200 milligrams of calcium per cup. Collard greens gives you about 200 to 300 milligrams. Spinach is a great source. If you're a vegan, don't worry. Look at broccoli has it, oranges have it, almonds have it. I love almonds, but they're a guilty pleasure, too addicting. Rhubarb, bok choy, I love bok choy, very underrated vegetable. Soybeans can be good. Kale, look at how much is in kale right there. A couple cups of kale should take care of your day. Dried figs, that's a great snack. Turnip greens, black-eyed beans, collard greens. You know, I'm not familiar with blackstrap molasses, but it has the most in it. I'd stick with the other ones if it was me personally. And many foods now are fortified with calcium, such as orange juice, almond milk, soy milk, breakfast cereals. A lot of breakfast foods. Tofu has a lot of calcium in it, 200 to 300 milligrams of calcium per 4-ounce serving. Canned sardines. So fish have everything. Fish have vitamin D, they have calcium, they have omega-3 fatty acids. That's a great choice. Almonds have a good amount of calcium, 76 milligrams of calcium. Dried figs, 1 cup of broccoli. These are all in the 50 to 60 milligram range. Cooked white beans offer 100 milligrams. Salmon, leafy greens, fortified foods, tofu, sardines, almonds, figs, broccoli, white beans, salmon, they all were great. And what are the best and worst calcium supplements? Factors to consider when taking a calcium supplement is absorption. You want to make sure your body can absorb it. How much calcium does it have? The cost and availability. You don't want to pay a lot for something you're not absorbing. And how well do you tolerate it? Sometimes people don't tolerate certain types of calcium sources. And again, depending on health issues, some people might not want to take calcium. It does have side effects like potentially causing constipation, can cause kidney issues if you have kidney failure. So check with your doctor. But we're going to do a countdown from worst to least. These are less favorable options. Coral calcium. This is less favorable due to environmental concern, and it's basically not the most absorbed type. Another type is oyster shell calcium. While it does contain some trace minerals and is more organic, there might be contaminants in there and you're probably not absorbing a ton. Calcium gluconate. This is a lower percentage of elemental calcium, and the forms might not be the most desirable. The ones that are kind of in the middle, not the worst, not the best, but calcium phosphate, it's well absorbed, has a middle amount of elemental calcium. But here's the good options. Here's what you want to focus on. Calcium carbonate. It contains a high amount of elemental calcium, making for increased calcium intake. It's absorbed best with food and well tolerated on an empty stomach. And then you have calcium citrate. This is considered to be one of the better, if not the best option. It's very well absorbed with food intake, and it is suitable for people with digestive issues. But here's the big secret on calcium. By itself, calcium, unless you're completely deficient, it does not do you good. There is calcium that's readily available. As long as you're eating non-processed foods all day, if you're eating anything reasonable, like any type of vegetables or any type of dairy, you're going to be good. The lack of calcium is not what causes osteoporosis in America. 2 things control your bone buildup. Your parathyroid gland, which releases parathyroid hormone, that makes the bones take up more calcium. And parathyroid hormone also creates vitamin D. So you have to have sufficient vitamin D. Both work on the intestines to take up and keep more calcium. If you have more calcium, more parathyroid hormone, more vitamin D, cells called osteoblasts, you can see them working here, they lay down more bone, they build more bone. If you don't have that balance, then cells called osteoclasts eat up the bone, chew it up, and you develop osteoporosis over time. This is the huge secret. Calcium, in my opinion, is one of the least important factors when it comes to osteoporosis, but people give it the most credit. This is the huge secret. Some studies actually revealed that excessive calcium intake and not balancing it properly actually increases cardiovascular disease, actually developing bone in your arteries, in your blood vessels. That's what stiffens them. That's called calcification. A study took a look at calcium supplementation. By itself, it actually potentially caused more danger rather than helping. It didn't really make bones stronger. It didn't really help. One of my areas of specialty are diabetics, diabetic calcifications, arterial disease. I work very closely with vascular surgeons, so I get a lot of these images with them. I unfortunately have to do a lot of wound care, a lot of toe amputations, and I'm talking like thousands of these, so I see this almost every day. In clinic, I always check the posterior tibial pulse and the anterior tibial pulse. If those feel good, you're probably in relatively good shape, but we also want to check how quickly the toes refill. But when you're checking the pulse, you want to see how much it's bouncing
bounding. If it feels smooth or you can't feel it, then you might need more testing. Capillary refill, it should refill in less than 3 seconds. And if those tests are not good, we use computerized tests to check the pulse, or you can do an ankle brachial index. So an ankle brachial index is a go-to for us, but essentially we just compare the pressure to other parts of the body and you check the ratio. If there's some type of blockage, the pressure will be lower in that limb. And what happens is you want to check for that bounding pulse. If it's missing, that means the vessel does not have flexibility. And at that point, we can order studies like a CT angiogram. That's basically a 3D image due to numerous x-rays. This can show narrowing or blockage. Now, I work very closely with the vascular specialists. They would go ahead and do this test. If that shows blockage, they would do something called the CT angiogram. They inject dye. They essentially poke your thigh and inject dye and see if the dye makes it down to your toes, if it swirls around, or if there's a blockage. But calcification can block it.
This is what you need to be doing instead. And this is our osteoporosis home remedy guide. Number 1, adequate vitamin D. Vitamin D in the news has been downplayed, in my opinion. They always scare you with toxicity and other changes, and yes, while it's possible theoretically to get toxicity, you'd have to take an insane amount. And number 2, they make it seem like people are over supplementing with vitamin D. But the truth is, a study was just performed that looked at 308 studies. This was just this year. We're talking 2023 going into 2024. 78% deficiency around the world. People are just as deficient as ever. And there's so many pros and cons to vitamin D. Your immune health, your depression, your mood, your sleep, your osteoporosis, it's all so important. I could name so many benefits to vitamin D, but 78% deficiency, odds are you, the viewer, are deficient, and odds are you're not getting the benefits as far as immune health, depression, sleep, muscle strength, bone strength. Calcium is worthless without vitamin D. Now, 78% of people in the world are vitamin D deficient. This is the big secret. Calcium without vitamin D is worthless. And realistically, with proper vitamin D, almost everybody's getting enough calcium, except for potentially someone who's a vegan or someone who's malnourished is not getting enough calcium. We've kind of seen from food, it's very easy if you're eating any dairy at all, any vegetables at all, you're probably getting your levels of calcium. But if you don't have that vitamin D, you're not uptaking it into your bloodstream. The study took a look at 308 different studies, and this was 8 million people in total around the world. And they found 78% of people in 2023 were deficient. They found that between 2000 and 2010, the deficiency was a couple points higher than between 2010 and 2020. So the media is basically making it seem like the supplements are not needed. This study, which is a high quality source, is showing the exact opposite. Almost everybody is deficient in vitamin D. There's the fear of vitamin D toxicity, but the reality is if you go on PubMed and look for actual toxicity reports, there's hardly any. And the people that do develop vitamin toxicity, number 1, it's pretty readily reversible. Even people who are taking 1 million units per day, once they stopped doing that, they got better. So symptoms were like nausea, vomiting, chills, that kind of thing. Now listen, I'm not saying to go out there and go crazy, but these are the studies. If I'm missing anything, tell me down in the comments. But this is the really big thing, is people are encouraged to take calcium, but somehow in news sources, I'm seeing vitamin D discouraged, but that's the one that takes up the calcium and prevents it from leaving your body. In my opinion, what you want to focus is on vitamin D. That's the big secret. And for sunlight as well. Another big secret is they did a study in Boston, and essentially in the winter months, so like the 6 months starting from like the fall to the spring, there's almost no vitamin D from the sunlight. So you could stand in your underwear in the middle of winter and you would hardly make any vitamin D, if any at all, according to this study. I go over that in my vitamin D secrets, specific dosages, tips, tricks, the best types of vitamin D, how to take it, what time to take it. Check out that video. That's called the #1 big mistake people are making with vitamin D.
In my opinion, vitamin D is perhaps the most important and biggest deficiency weak bones, weak immune system, fatigue, low mood, tough time sleeping. Some sources recommend 5 to 10,000 international units per day, but official government regulations are a lot lower to be on the safe side. It needs sunlight to be made unless you supplement, but in the winter, it's very difficult in a large portion of the world to make. It is very important for osteoporosis and your overall health.
Another one is vitamin K2. Vitamin K2, this is different than vitamin K1. Vitamin K1 is involved in our clotting. Vitamin K2 is important in taking that calcium from our bloodstream and putting it into the bone.
K2 is different than the electrolyte potassium, which you might get in your Gatorade type drink. There's 3 different types of vitamin K. K1 is phyloquinone, vitamin K2 is menaquinone, and then vitamin K3, not really important, but I list it here.
There's a lot of studies out now about the huge benefits of vitamin K2. This is pretty much a newer, scientifically studied vitamin. It's been around for a long time. It's not really even recommended by the government, even though the studies are so good at this point.
The World Health Organization, FAO, say that people probably only get 5 to 25% of their daily recommended value of vitamin K2. There's 2 types, MK4 and MK7. MK7 lasts a lot longer, and it's found in fermented foods, natto, soy, sauerkraut, cheese. It is also made by GI tract fermentation.
Vitamin K2 takes that calcium from our blood and puts it into the bone. Vitamin D puts it into our blood by working on the parathyroid hormone, improving it from our digestive tract into our blood, and then vitamin K2 takes it from the blood and puts it into our bone. Benefits of vitamin K2, bone health. Vitamin K2 is essential for the activation of something called osteocalcin, a protein that binds calcium to bones. This is critical for bone density and preventing osteoporosis. Essentially, vitamin D puts calcium into your bloodstream, and vitamin K2 takes that calcium and puts it into your bone and organizes it in your bone. It's important for your cardiovascular health to prevent arterial calcification. So it takes that calcium out of your arteries and focuses it into that bone where it should be. And there's a lot of great studies how vitamin K2 lowers calcification.
You want K2 to come in the MK7 formulation in your supplements, but the beauty is that vitamin D and K2 can come packaged. You don't have to go crazy and buy a million different supplements. We're going to give you a simple, easy plan that I follow myself at the end.
Very, very important. Does a lot of other things. We want to get about 120 to 200 micrograms. That's micro, not milli. It is found in food, natto. It's found in certain types of meat. In our processed diets, most people are not getting enough. Supplementation might be a good idea. Check out our video on vitamin K2, our dosage, our recommended supplements to get that below, and our practical plan. Number 3, magnesium. Listen, just like vitamin D, magnesium is like 60+% deficient in the world. Magnesium is very important in activating vitamin D. From going from the inactive form of vitamin D all the way to the completed form, certain enzymes along that pathway use magnesium. And if you're short on magnesium, you might not develop enough. Magnesium is also necessary for things like parathyroid hormone, which regulates our calcium levels in the blood up or down. And magnesium is needed in 600 enzymes. So listen, these are like the basic most important building blocks to help your immune system, your bone health, your overall well-being, not just osteoporosis. So make sure you get magnesium in. Check out all our magnesium videos. There's a lot of different types, a lot of different absorptions. A lot of people are taking the wrong ones because the wrong ones, unfortunately, are the most readily available, and there's hardly any absorbed into our stomachs. For a man, per day, you want to get about 420 milligrams per day. For a woman, you want to get about 300 milligrams per day. That being said, that's just an average. If you're a really tall woman or a really short man, that could differ. I'm not going to get into kids dosing because under 18, I don't deal with kids.
These are common options that are meant to be laxatives. So magnesium oxide is very common. It's meant to loosen your stool, not to give you magnesium. Same with hydroxide, that's milk of magnesia, just to loosen the stool. Magnesium carbonate, so these are antacids. You don't actually absorb these. And magnesium sulfate, same thing. It's a laxative. You're not meant to absorb these. So don't take these. They're not beneficial in terms of acquiring magnesium. But don't get too upset if you, for example, take magnesium oxide or it's in your supplement container right now, because it still gets into your system, even though it's not the most absorbed one. But magnesium citrate, good absorption, good for your stool. That's kind of the main thing I think about with citrate, is it helps you go, which could be a good thing if you're backed up. Magnesium citrate powder, same kind of thing. It just doesn't come in capsules, but good for your stool, good for calm. Magnesium glycinate, I go over this in some of my sleep videos, but glycine by itself helps you sleep. Magnesium and glycine help you sleep even more. And the good news is no loose stool with magnesium glycine. That comes in powder and pill form too. I have a video on magnesium threonate, lots of good studies on the brain, the central nervous system, a little bit more expensive, but can be worth it for older people with memory issues. Magnesium orotate, a little bit more expensive, but more energy, meant more for athletes, taken up a little bit better. Same thing with magnesium taurate. There's some studies that it works well for blood sugar, for diabetics, might be a good option. And magnesium malate, it's been shown to be studied for fibromyalgia and can be a good anti-inflammatory as well.
What type of magnesium do you want? I go over a video, all my favorite types of magnesium, but I like magnesium threonate for brain function. It's a little bit more expensive, but studies are really good. Magnesium chloride, magnesium citrate, and magnesium glycinate. Especially if you want to get to sleep well, glycinate works really well. Check out my magnesium videos. I go over all the studies, all the details below. Then number 4 vitamin, you want to take omega-3 fish oil. So if you have osteoporosis, check out the omega-3 fish oils. They're very important in studies. Omega-3 basically it should be in a ratio of 1:1 with omega-6, but in the United States today, our omega-6s are about 25 times greater than our omega-3s. So that ratio is out of whack. You want to correct it. There's so many great studies on omega-3, but it also affects your bones and osteoporosis.
I link my favorite omega-3 supplements down below, but you want to get about 1.1 grams per day for women or 1.6 grams per day for men. EPA, DHA are the way to go. ALA is plant sources. Get at least 50% fish oil. That's the big trick. The side effects are burpee and fish smells. You want to get ones that are cost effective and make sure they're mostly omega-3 fats. Some of the bad quality ones, they're like 90% bad fat and only like 10% fish oil in the capsule.
Zinc and boron. So these are trace elements, but zinc levels have been shown to convert vitamin D to the active form, so it's needed. A deficiency can impair your vitamin D.
Zinc is a cofactor in 300 enzymes. You want to get about 15 to 30 milligrams daily. It's in tablets, capsules. There's not a lot of known side effects unless you really go crazy, but just get a multivitamin. You're going to easily get your 15 to 30 milligrams per day. Especially for men, it's important for testosterone production.
And boron, while it's not a direct interaction, it can contribute to your overall mineral metabolism and bone health. You just want to get a multivitamin. You don't have to go crazy with these extra ones. All of these work on the 75% of bone, which is the calcium phosphate. So like our hard ceramic bone, but then you also have supplements like Coact. This is a complex that works on the collagen. So 25% of our bone is collagen. That's like our scaffold. And collagen is not made from minerals.
If you look at the composition of bone, about 2/3 of it is ceramic material like calcium and potassium, but the rest is made of organic compounds, mostly collagen. So now what's collagen? Collagen, when you start shrinking down, at first you see the hard bone, but then you see the cells that make up the bone, and then you get down to collagen fibers. These collagen fibers are made up of tropocollagen, and this is the base element that adds the flexibility and the scaffold. This has to be nourished as well to avoid osteoporosis.
I go over supplements looking at these collagen replacements. Is it worth taking? What are the studies? Check it out in our brand new bone and osteoporosis best supplements and worst supplements video guides. When should you take these vitamins and when should you take calcium? Most studies show that vitamin D and calcium is better absorbed with food. Hey, listen, the best way to get these is in food anyway. Vitamin D and calcium are usually found in things like milk, salmon, cold water fish, vegetables. Something else to consider too. If you're getting too much calcium through vegetables like spinach and kale, some people are susceptible to oxalates and phytates. These things can lead to things like kidney stones. There's some claims of inflammation, so like that Plant Paradox book. Although the studies, do they really support this? This is a controversial issue. What do you guys think about the Plant Paradox? I think the studies are a little bit over-exaggerated to sell some supplements. What do you think? Tell me what you think. Hit me up in the comments. I'd love to hear your thoughts. Good experience with oxalates, bad experience, doesn't matter, tell me. So why are some people short on calcium? Number one, being a vegan, being a vegetarian. If you're not getting dairy, dairy's probably the easiest way to get calcium. That could be why you're having a shortage. So it might make sense to supplement if you're on certain medications. So a lot of medications, especially antibiotics, could really limit the calcium intake. You want to focus on calcium carbonate, calcium glutamate. Those are good ones. But this is really what's most important for osteoporosis. Not only do you need your calcium, but more importantly, your vitamin D, your magnesium, your vitamin K2, your omega-3s. What's something practical? Well, realistically, rather than taking a million different pills, you can get your vitamin D3 and K2 together. I link some of my favorites below. Magnesium, you can supplement that with powders, some pills, and omega-3s, you have to take those separately. I link some of my favorites below. These are the main ones. Realistically, outside vitamin D, K2, magnesium, and omega-3s, and maybe creatine, which I link below on my videos on that too. Really all you need is a multivitamin. You don't have to go crazy and get 800 different things. These things are just proven to be so important, even though it does cost a little bit. Relatively, the cost is almost nothing by comparison to getting sick for a week, 2 weeks, missing work, and it happens to all of us in Michigan here. We all get sick, we all get the flu. The single number one most important secret is you need to strength train. Strength training scares a lot of my patients because most of my patients are retirement age. They're seeing me because they have significant joint problems, foot, knee, hip, back. But listen, strength training, they have done studies over and over. This is the single one most important thing you could do for your mortality. So the British Journal of Medicine did a study in 2020 and they looked over the last 20 years and what are the most common things people did to avoid dying or diseases. By far number one was strength training. This is simple stuff. Strength training is wall push-ups, air squats, so leaning up against the wall and pushing back and forth is an easy solution. Air squats, and we're talking just 30 seconds, a minute, but doing it every day. You could take a book, lift it up in front of you. You could do sit-ups. You could go for walks. These are all weight-bearing exercises. These strengthen your bones. There's something called Wolff's Law, and Wolff's Law says bone that has stress placed on it will strengthen.
Wolff's Law states whenever there's more pressure, more compressive force, that bone will develop more strength, more trabeculae, more fibrils to strengthen itself against that force. So the more stress and the more strength training you do, the stronger your bones will be.
People who progressively load their bones will have much stronger bones. If you're doing all the things I talked about and you strength train, there is a really good chance you will have very strong bones, very strong muscles, and you will do really good. Strength training, more important than cardio, but cardio is really important too. Realistically, you only need to work out 10-15 minutes 3 times a week for the single most healthy thing you can do for your body. You know, it's not easy. That's why me and Coach Ryan, who's a basketball star, phenomenal shape, we've come up with a 30-day guide to turn your health around. We have a guide on that below. That course goes over everything you need to turn your health around. Strength training, cardio, better sleep, better diet. We have a registered dietitian who is my wife helping with the diet aspect. And then number 5, that's the extra stuff like the supplements. Supplements are actually last place, but check out that 30-day course. You won't regret it. That's linked down below.